All right. Just to give you a quick status update, we're hearing that there are at least 2 other members who are desperately trying to get into this hearing to ask you questions. I will entertain a 3rd round.
Lucky me.
Lucky you. And if they do not appear before the end of our 3rd round, we will let you go. So I want to focus for a moment on the Centers for Medicare and Medicaid Services, or CMS. This agency provides services for millions of Americans through Medicare, Medicaid, and CHIP. Wisconsin families and seniors rely on these programs, and I believe that we need to do everything that we can to ensure that they are working effectively to provide the care that our constituents deserve. Funding for program management at CMS was flat for almost a decade. Can you describe the negative impact that not investing in program management activities has on Wisconsin families and seniors and American families and seniors?
Senator, thank you for the question. I know everyone always focuses on what we do on the ground to help families, and that is absolutely what our governments, local, state, federal, have to do, is be there for folks when they need us. The folks who are there when they need us are the folks who often get neglected when it comes time to providing budgetary authority. So we provide money, Congress provide, and I was here for 24 years as a member, so I remember those days. We'd always fund the program, but we would neglect or skimp on providing funding for the personnel. CMS is essentially in that strait. For the last 13 years, its budget actually has gone down. At the same time, its population that it serves, Medicare, Medicaid, CHIP, ACA, Marketplace, has gone up by over 40%. So it's going in totally opposite directions. Every year we're doing more. CMS is negotiating the drug pricing. CMS is helping states address the Medicaid redetermination so people don't lose their coverage. CMS is having to deal with all these determinations about whether Alzheimer's treatments or cancer treatments will get covered under Medicare. CMS is a workhorse, but it's not getting fed. The people that are doing all the work, unfortunately, are stressed. So anything we can do to ensure that we can continue to have good production would help. And by the way, I haven't even mentioned cybersecurity. CMS, when Change Health suffered that cyber attack, CMS, through Medicare and Medicaid, was there to make sure doctors and hospitals still got money, even though all the systems, electronic systems, had gone down. That was CMS.
You mentioned many of the functions that CMS participates in. Can you speak also to nursing home inspections?
Well, it's, I hate to say it publicly, but I think every American who has their loved one, their mom, their grandfather, their disabled brother in a nursing home expects that there's going to be quality care. One of the ways we ensure quality care is to do inspections, to do the surveys, to make sure that these facilities are providing real care to Americans that we love. Unfortunately, the resources that we have received, especially on the administrative side of the budget, don't allow us to do the surveys 100%. We did over 2/3 of the surveys that we needed to of the nursing homes throughout the country. The funding has continued to go down. I fear that we're going to continue to drop in the number of surveys of nursing homes that we're doing, which one of these days is going to result in some nursing home being in the news because some tragedy happens and it's a nursing home that we didn't have an opportunity to inspect. That should not happen. And if we had the resources, and it's a small drop in the bucket of all the money that you all provide CMS, that would help us make sure that nursing homes are safe.
Thank you. Senator Shaheen.